Good morning, students. This is for the exit exam, Diploma in Pharmacy students. In this class, we are going to see a subject Pharmacology. We know that it is exit exam have been the tentative program have been given by Pharmacy Council of India. It is 5th of October in this year 2024 and 6th of October 2024. So these classes will helpful, and I got suggestion from the viewers stating that not to be very lengthy class, short class will be helpful for us. So I have taken in each subject only 15 questions or 20 questions like that. So it will explain within half an hour I will try to finish, so that the next class we will continue with another 15, another 20 like that. Minimum 500 question if a student in one subject, if they are undergoing, it will be helpful for them, because we are seeing not only the answer, we are seeing the possibility of other questions. What is the meaning of why the answer is the choice have been given, have been selected. So this will be helpful for revising your subject. Even though if they ask in twisted questions, it's possible for the students to answer. So we have seen one class in pharmacognosy and in pharmaceutics. Now we are entering into pharmacology. So I hope the suggestions and how to improve my class for reaching to your knowledge and to memory and to write the exam, it needs more suggestions and the comments, merits and demerits, because I will be having lot of demerits mostly. So that I will correct it and I will improve my class to my students. That's what my aim, to get your reply. And so I would like to make the viewers, ask the viewers, request the viewers to subscribe my channel and to visit my channel Pick Pharma DXP at DX Prasad in YouTube, so that there are many other classes also there. This will be not only useful for Diploma in Pharmacy students who is going to appear GPAT, which is having, now they have given the date also, and the other Public Service Commission exam for the pharmacist. This will be more helpful, I hope. So I would like to express my diploma students to just to second years or first years also, even when you are studying pharmacology, it's needed for you to go for your revision what you have studied. So kindly subscribe my channel in Pick Pharma DXP at DX Prasad. This is about the MCQ in pharmacology. First question they have given is, which animal is used to study the effect of meiotic agents? So when we talk about meiotic, meiosis, mydriasis, these all things we have studied in your physiology and in pharmacology. So the students should be known to the question very clearly. Then only when you are answering it, if they ask animal only, it is easy. Anyone can say, because you might have done the lab practicals for mydriasis, meiosis with rabbit. So immediately you can just, but why the rabbit and what is meiosis, what is mydriasis, these all things sometimes twisted, they may ask question. So meiotic acts or act by stimulation the sphincter muscle of the iris. Even the sphincter muscle, there is circular muscle, radial muscles are there. So stimulating meiosis will take place by the circular muscle construction usually. Your teacher might have explained, which in turn causes construction of the pupil. Pupil will become small. Pupil is small aperture or the hole which is present in our eye, which the rays, the vision which we can see, the rays have to enter into that through the lens. That is the slit, you can say slit, or the small aperture which is present in the eye. So this is the place. So you can see some of the drugs which you are given for in the eye, we might have checked in the pharmacology: acetylcholine, chloride, pilocarpine hydrochloride, and carbachol. These are the drugs which are causing meiosis. Actually, these all drugs are parasympathetic. They all of them are cholinergic drug which causes meiosis. So this some of the points. They may ask different types of question in this part. One question I am giving many choice to get an understanding. So you see, Adrenergic, meiotic, the student have to have a capacity to always not to come to any type of confusion. Adrenergic means opening, enlarging or dilating the pupil. Meiotic means constriction. The agent or the drug used is for glaucoma actually. Glaucoma means the pressure which is developed in the eyeball. So it can be controlled by means of these type of drugs for Adrenergic or meiotic according to the physician's diagnosis they may prescribe. So you say meiotic means constriction of the eyeball where the becoming small the eyeball due to the circular muscles constriction. And radial muscle constriction, you can see the picture, there is radial muscle. Meiotic, when they are pulling the radial muscle, automatically it will give Adrenergic. So Adrenergic drugs usually, adrenergic drugs, cholinergic drugs will cause meiotic. This is just a simple we can remember. Animal which is used usually in experiment for conducting this experiment of meiotic agent to, if you want to analyze, by using acetylcholine drops can be applied to the eye of the albino rabbit. You can see the rabbit which I have shown the picture. The eye, you can see there is two pictures which I have shown. One is constricted one is dilated one. So just to see that when you are, the pupil can be easily identified in rabbits. So the animal which is used for study meiotic agent is rabbit. They are given guinea pig, frog and rats are the answer. But we can select rabbits. So the students can now, within one question, you can have lots of questions can be asked and you will be able to answer also what is meiotic, what is Adrenergic. I hope which will be helpful for you. Now ephedrine is used as, they are asking ephedrine. So ephedrine, the second question, ephedrine, when we talk, it is an adrenergic drug, but ephedrine, everybody will be having a confusion whether it is having a structure relation to the adrenaline. No, adrenaline, epinephrine, they are different. They are a neurotransmitter which is produced in our body also. So ephedrine is different structure. But ephedrine, usually every student should know, ephedrine will be contained in a bronchodilator syrup or elixir, even which is available in the market. They will be using for a asthmatic patient or bronchitis. They will be giving this ephedrine this as a syrup usually. Tablets is also available. So ephedrine is having an adrenergic action. So this is the structure of epinephrine, or you can say adrenaline, which is a neurotransmitter, which is an adrenergic drug. So ephedrine is also an adrenergic action. But they have given a choice whether it is Adrenergic drug or meiotic drug or laxative drug or antacid drug. So you know pharmacology very clearly. Here we are talking about meiotic and Adrenergic. I was telling about adrenergic, cholinergic, and I given an example also for cholinergic drug like acetylcholine, pilocarpine and carbachol. They all causes meiotic and they are cholinergic drug. And I told ephedrine is related to epinephrine or it is related to adrenaline, which is an adrenergic drug. So surely it is a sympathetic drug, sympathomimetic drug, which can cause Adrenergic drug. So the student should not make any mistake. Always you should have an idea about ephedrine causes Adrenergic drug. Mydriasis dilates the pupil. And number 3, the question, which animal is used for pyrogen test? So pyrogen test is also, you can use pyrogen test. We are using animal is rabbit, everybody knows. But still we should know what is the pyrogen, what for, how the test will be done. So these all things sometimes they may twist the question and they can ask. So if you have some knowledge about pyrogen which causes elevation in your body temperature. It increases the body temperature. So when you are injecting any type of injectables, it's very important whether you are using pyrogen free water. That is, water for injection should be pyrogen free, and any type of parenteral drugs, pyrogen should not be there. So pyrogen makes it will cause elevation in your normal body temperature, increases the body temperature. So how will you find out whether it is by means of animal which can be used? It will be injected in the ear vein of the rabbit. That is what the picture which I have told, the ear vein, and you can see that is lateral marginal vein. Usually we will be using, even you will have an artery also in the middle of the ear of the rabbit. So when you see some of the things which you should know before going to the answer, we know answer is they might have given rabbit, frog and albino rats. They may give an experimental animal which will be used for testing pyrogen. But you should know about pyrogen. What is pyrogenicity? How the in vivo pyrogenicity test is conducted in healthy adult rabbits by evaluating the rectal, evaluating. You should find out what is the rise in the rectal temperature. In the rectum of the rabbit, they will keep the thermometer, that is called Tellis thermometer. After IV injection of the test sample will be given to the ear vein of the rabbit. That's what it is written. IV injection of the test solution is given in the ear of the vein, which will be giving the rise. If it is giving rise in the temperature in the anus, when you are keeping after the certain period of the procedure, when you follow, if you give this thermometer, Tellis thermometer, keeping in the anus, you can find out what is the variation. Delta T can be identified, and even you can sigma delta T can be calculation. There is by means of making 5 samples controls and can be also kept, and we can find out the elevation of the temperature, body temperature of the rabbit will give you the evidence whether pyrogen is present in the given sample of the sample of the liquid, or sample of any given sample contain pyrogen or not can be identified by a pharmacologist. So you see, they have given some rabbit, guinea pig, mouse and frog, but we know that it is rabbit. So don't forget rabbit, Tellis thermometer, ear vein. These all things are very important. There is why I am taking description for each question, because they may twist the question, they may ask in different manner. So I am giving a brief idea about the question, and what is pyrogen also I have given. So this will helpful for you even though they are asking in different form of the question. Number 4, which paper is used for recording of activity of recording drum? So you should know what is recording drum. It's a vague question. Where is the recording drum? What is this recording drum? That is chymograph meter. You might have studied in the heart, which will be isolated, and we can record the rhythm, and the abdominal muscle can be isolated, and we can record a graph in a chymograph, which will be in a drum. It is usually 6-inch, 7-inch drums are available, which will be rotating in a certain speed, can be controlled by your work. This is that which the experiment which you are using, chymograph rotating drum, which can be connected with the isolated heart, and the needle which will be, that is smoked drum, that is carbon smoked drum, where you will get a graph, which by that we can identify what is the action of acetylcholine, what is the action of adrenaline, what is the action of atropine, what is the action of sodium, what is the action of potassium. These all things can be identified, and what is the action in the heart, and what is the action in the muscle. These all things, even ileum can be removed from a guinea pig. That is also can be used for finding out what is the action of acetylcholine over a muscle, whether it is contractility is increased or decreased. These all things can be identified. So students have to remember the paper used in recording for the activity on recording drum means a pharmacist should remember. It's the question is not having much detail about chymograph or pharmacology experimental things, they are not mentioned. But you are a pharmacist and you know the pharmacology experimental methods, so you should have an idea. This is about that question only, because the answer, drum carrying a sheet, which is shown in the black in the picture, the drum carrying a smoked, that is carbon smoked paper, will be pasted on the drum, and it will be scratching by a pen or a needle, which is called a chymograph, which can give, that can record and you can just that chymograph can be made into fixing by using colophony solution. That is also, they may ask, what type of solution can be used for fixing a chymograph in a pharmacological experiment. These type of questions they may ask. So students should know all this type of experiments which you have done. If you are done in the lab, you should remember the laboratory things, whatever you have observed in the lab. So you will never forget. It is very easy for you to answer. So they have given choice chymograph. We know the answer chymograph, and they have given graph, they have given craft, they have given white. These all are simply whiteboard, or they have given simply an choice. But chymograph is the answer, and why it is chymograph, what is chymograph, what is the use of this identity of this type of experiment, I have given detail. So you should know certain words whichever I have used. They may ask in twisted question also. Students should not do any mistake. They should be able to answer. Then you can see number 5, that is potassium dihydrogen phosphate is a constituent of. So you should know what is potassium dihydrogen. Choice may be given. Usually where it is present, because we are dealing with pharmacology, we should know potassium dihydrogen may be used in some solutions. So you should know it is used in Krebs, Henslett, or Henslett, I can say scientist name, Krebs cycle. These all, Krebs means, you should remember, we have studied Krebs cycle. That is in plants also, in animals also, biochemistry, plant chemistry, biochemistry, then animal biochemistry also, Krebs cycle, citric acid cycle, which you might have studied. That means Krebs, a scientist, that is Krebs. Henslett is the name of buffer, is produced using calcium chloride, potassium chloride, magnesium sulfate, calcium chloride. First one is sodium chloride. Here it is calcium chloride and potassium dihydrogen phosphate. So this is the potassium dihydrogen phosphate is a constituent of Krebs Henslett buffer. Krebs Henslett buffer is a buffer modifier, is a balancing salt solution, BSS, sometimes short form they are given, that is used for cell culture. In tissue culture, cell culture maintaining in the medium, it is necessary to maintain the pH and to give the strength of calcium chloride and potassium dihydrogen phosphate. It is used for cell culture, place a provision cell in water and with inorganic salts, sodium, potassium, magnesium for the normal cell metabolism. So these are used for actually an electrolytic solution which is used for cell culture, that you should remember. So they have given a choice. This is the dihydrogen phosphate, potassium dihydrogen phosphate, which is the constituent, which is the ingredient, main ingredient of Krebs Henslett buffer, but it is not present in Frox-Ringer solution, Lock-Ringer solution, De-Jalon's solution. So Frox-Ringer solution, Lock's-Ringer solution, De-Jalon's solution, Krebs Henslett solution. These all solutions are used in pharmacological experimental pharmacology for making the tissues and the cells and for giving their electrolytic balance, and in various experiments. So they contain different ingredients which gives the strength, and for their up to the experiment should be conducted. So these all solutions, what for it is used also, sometimes they may ask in different twisted question. I have even taken that also for you to explain in the next slide. And you can see number 6. So the answer for the 5th question is potassium dihydrogen phosphate is present in Krebs Henslett solution, and Krebs Henslett solution is a buffer modifier, balancing salt solution, electrolytic solution, which is used for cell culture and providing cells with water and inorganic salts, and normal cell metabolism will take place there. And what is the use of calcium chloride in physiological salt solution. Calcium chloride is one of the things which is always in all the solution, even it is present in Krebs Henslett solution. Why? What is its use? So calcium ion contributes to the physiology and the biochemistry of organism cells, and they plays an important role in signal transmission pathway. It gives signal transmission pathway, and which they acts as a second messenger. And the neurotransmitters you might have studied about adrenaline, noradrenaline, or epinephrine, norepinephrine, and acetylcholine, like sympathetic and systemic, and also you might have studied about many other neurotransmitters also. So you can see release in the neurons, acetylcholine or dopamine, these all are neurons. In contraction of the muscle cells, it takes place. It is used even for fertilization, calcium is needed. So in this junction I have underlined, it has many action, but it is contraction of the muscle cells. That will be the question which is asked, that is why. It provides contractility. So it provides contractility is the answer. They are given a choice, it provide ionic balance, because the students will confuse ions, calcium ions, so they may give ionic balance, no. And to stabilize the preparation, no. And to provide alkaline solution, no. So you should write it is provide the contractility. You should know that what is the calcium contributes in various electrolytic solution which is used for pharmacological experiment. And next, number 7, which physiological salt solution is used for experiment to isolate heart and rectus abdominis muscle preparation. So heart isolation from the frog and rectus abdominal muscle in the preparation, we will just fix with the chymographic instrument which I have shown in the picture, and we will study about what is its action. As I told before, to action of acetylcholine, adrenaline, atropine, and sodium, potassium, and even we can go for many other drugs action, comparison of the standard, and what is its heart beat, what is the rhythm change, all these things can be studied. And also in the muscle, when you see rectal abdominal muscle, which can give you all the contractility, relaxability, excitability, all this thing study can be done. So frog ringer solution, they have asked a question, which physiological salt solution is used for isolated heart, that is isolated organ, isolated heart, or isolated rectum muscle, rectum abdominal muscle of the frog. So frog ringer solution is the answer, and D Jolon solution, lock ringer solution, and Krebs Henslett solution. We have seen Krebs Henslett solution already. It is for cell divisions, or you can see it is for culture and tissue culture, cell culture, it can be used. So you can see frog ringer solution is the answer, but we should know why. Frog ringer solution is a kind of balanced salt solution which is close to the amphibian internal environment like frog. So you can see it is in vitro experiments. It can be used to prolong the beating time of the heart, and maintain the physiological activity of the isolated tissues and organs in vitro. So when you are isolated heart or isolated the rectum abdominis muscle from the frog, can be maintained for your experiment to giving various drugs which we want to experimental pharmacology. So that is why that is the main thing which can be used for isolated heart or abdominis muscle preparation, it can be used. And D-Jolon solution is a kind of balanced salt solution in biochemistry. The main component is sodium chloride, potassium chloride, calcium chloride, sodium bicarbonate, and glucose. They are often used for rat uterus in vitro study. So when you want to go for fertilization study, uterus study, and egg ovum study, all these studies, when you want to histological study in the uterus of the rat, then they will use this D-Jolon's solution. So that's why I told all these solutions are used in pharmacological experimental methods. And you can say ringer lock solution. What is this ringer lock solution or lock ringer solution? This solution is used in animal with dyspepsia, other diseases, accompanied by dehydration and intoxication of the body, blood loss, and wash of the wounds and eyes study can be given. So one solution for the purpose we should remember. And Krebs already we have seen it is used for cell culture, in tissue culture, and the role to provide the cell of inorganic salts, inorganic elements for their cell metabolism. So this is the 8th question. Which is the effect? What is the effect of adrenaline on action potential? So students should remember about the action potential what you studied in the general pharmacology. So action potential, you just see the graph. It is a voltage in the y-axis, time. According to the heart rhythm, heart or in any muscle, there is a threshold level, stimulus. So when you are giving a stimulant drug or a neurotransmitter like adrenaline, immediately depolarization takes place, and then repolarization will take place, and then it will come to the refractive state and it will go to the resting state. And there is a small curve which is shown also, failure initiation. Sometimes the receptor may not work by means of the transmitter or the drug which have been injected. So this depolarization means it increases the peak to achieve the action potential. Repolarization is decreases, and refractive period is below, and resting is null. So you should know, sometimes the question may be asked in different manner. Here they have asked, what is the effect of adrenaline on action potential? It's very clear. Adrenaline is an adrenergic drug. It will start depolarization. So it will increases the action potential. 100% sure by the graph and what you studied, it's possible for you to answer. But what is the choice they have given? Because you should know some more things about the action of adrenaline. They may ask in different manner: depolarization, repolarization. They may ask threshold, stimulus, resting state, and refraction period. These all things can be incorporated in the choice also in another question. So we should be able to know what is the action potential, what is the action of adrenergic drug, what is the action of cholinergic drug. And actually an action potential is a rapid sequence of change in the voltage across a membrane. That is a definition. The membrane voltage, maybe a heart, maybe another tissue, muscle tissue, wherever may be, the membrane voltage or the potential is determined at any time by relative ratio of ions, that is extracellular to intracellular. That means extracellular to the transmission of the ions, sodium or potassium, transmission from the extracellular to the intracellular, the movements which will cause the permeability of the ion, which is relative ratio, which causes that depolarization, action potential. So this should be known for you. What is the action of the and adrenaline shift? What is the adrenaline is doing? Adrenaline shifts the relation between activation of the potassium current in the membrane potential into a depolarization. So depolarization in the graph, it shows increase to the action potential. So adrenaline activation of a potassium current and the membrane potential in a depolarized direction. So consequently, during the pacemaker, we are talking about the impulse of the AV node, SA node, pacemaker potential, the potassium current falls rapidly to lowers the value inward current and depolarization in the membrane more quickly. So this is the thing which is what generally idea you should know. Even though you are a diploma student, you need something about the what is the action potential, what is depolarization, what is repolarization, what is the voltage, how it is related to the cardiac rhythm. So here the question is, what is the effect of adrenaline on action potential? It increases very clearly. They can ask even depolarization, repolarization, or you can say refractive period or resting rate, like that also choices can be given. But here they have put it increases. It increases 100%. It doesn't decreases, it doesn't stops, and none of the above is also not the answer. So the 9th question, what is the use of adrenaline? Now we have come across many questions. Adrenaline is an adrenergic drug. It has a stimulant action towards heart. All these things we have studied. So they are coming to the heart action. They have given a choice. treatment of bradycardia is the answer. Bradycardia means lowering in the heart rate, and treatment of tachycardia is opposite, it's not the answer. And treatment of uterine disorder also not given adrenaline, and treatment for the kidney failure also not, adrenaline will not help for that. So but you can see in the choice, the more prominent answer is treatment of bradycardia. So students should know what is bradycardia, what is tachycardia. Simply if I say bradycardia means less heart rate, tachycardia is the increased heart rate, means you will forget. If you see some picture or if you see some definition, then you will not forget. Bradycardia can be caused by the heart tissue damage. Sometimes it may damage to the heart tissue related to aging, damage to the heart tissue from the heart diseases, and heart attack is also bradycardia. Lowering the heart rate will come down, and even it may be symptoms for attack, heart attack also. So you can see you should be very careful. Bradycardia is slowing down the normal heart rate. So you should know, as a diploma student should know what is the normal heart rate, and a normal adult resting heart rate is between 60 to 100. If it is below 60, 100% sure you are having some issue with the heart, so you have to go for checking the BP or checking some angio. Is better to do a diagnosis. Understand? So bradycardia is if it is less. So when a person is having bradycardia, you will get a graph like this. When somebody is giving ECG graph, you should not say I don't know what is it, because you have studied. A diploma pharmacy student have studied PQRST graph. So you should see the bradycardia, how the normal, you will have one peak and two small peaks, and one peak rhythm is constant, and every second. So you can see in every second you are having 1, 2, 3, 4, 5. See, there is only 3. So that is rate of the beat have come down, and the graph is becoming lengthy. So you see that it's a bradycardia. And when you see tachycardia increased heart rate is a medical term for heart rate is over 100, more than 100, and beats a minute. So many types of irregular heart rhythm causes arrhythmias and can cause tachycardia. So tachycardia graph you see in the normal and tachycardia. You can see 1, 2, 3, 4, 5, 6. There normal is 5, means it's 6, 7. Sometimes the graph beat is increasing, and the peak is also, you can see the peak, how the PQRST, how the rhythm of AV node and SA node and the systemic and diastolic pumping of the heart, the rhythm, how it can be easily identified in the ECG. So this is the thing which you can see very clearly. But here the adrenaline is used for the treatment of bradycardia, because it is an adrenergic drug which can improve the contractility of the heart, and it can improve the heart rate, increase the heart rate which is decreased by due to bradycardia. Remember, 10th question, which adrenergic receptor is present in the heart? You might have studied adrenergic receptor. There are many receptors are there. Alpha receptor, beta receptor, alpha 1, alpha 2, beta 1, beta 2, now beta 3 also have been identified. So they have asked which adrenergic receptor is present in the heart. So you should know that, already we have studied. So cardiovascular alpha adrenergic receptor evoke vasoconstriction. The cardiovascular beta receptor evoke the vasodilation and heart cardiac stimulation. So in human heart there exist alpha 1, beta 1, beta 2 adrenergic receptor, and also they have cholinergic receptor also, like M2 Muscarinic receptor, and also possible in the presence, and also alpha 2 receptor which is also present, which is identified. So you can see which one is really present in the heart and what is its action. This picture also gives you more idea about ANS, that means autonomic nervous system. When you are studied in pharmacology, these all things questions can be asked. Sympathetic nerve, parasympathetic nerve. Sympathetic nerve will come as sympathomimetic, sympatholytic, parasympathetic, parasympathomimetic, parasympatholytic, adrenergic drugs, cholinergic drugs, like that you might have studied. And sympathetic nervous system which will release noradrenaline, and noradrenaline which act on the receptor beta 2, beta 1 in the heart. And you can say cholinergic receptor M2 will be stimulated by the neurotransmitter acetylcholine, which can cause this chronotropy, dromotropy, inotropy, lysotropy. This also one of the things, positive, negative, the symbol which is designed in the picture, very clear for the students to remember. So adrenergic drug will stimulate, which will give positive for chronotropy, which will give positive for domotropy, which will give positive for inotropy, which will give positive for lysotropy. But M2 receptor, a cholinergic receptor, which will control them, they are anti, they will stop, they will reduce the chronotropy, they will reduce the dromotropy, they will reduce the inotropy, they will produce the lysotropy. So this all things, just in this question you just have an remembrance, and then we will discuss. So here in this simple question, which adrenergic receptor is present in the heart? They are given choice beta 1, beta 2, both A and B, and M2. And you can just click both A and B because beta 1 and beta 2 are present in the heart. They are adrenergic receptor. M2 is also present, but they are not adrenergic receptor. They are cholinergic receptor. They are parasympathetic nervous system, which are negatively reducing the chronotropy, dromotropy, inotropy, and lysotropy. So you can see number 11th question, acetylcholine is a neurotransmitter, which you can see in the picture of parasympathetic nervous system. So they are asking what is the acetylcholine. Just now we have discussed they are neurotransmitter in parasympathetic nervous system. It is a cholinergic drug, which is synthetic drug is also available, which is acetylcholine is a cholinergic drug. Adrenergic drug? No. Sympathomimetic means adrenergic drug. They both are the adrenergic, sympathomimetic. Sympatholytic means we can say it is cholinergic drug. Nicotinic drug? No. So the answer is cholinergic drug. Very important for the students should know. What is the effect of is given by acetylcholine? So again I am coming to the picture which I shown there. You can have a positive chronotropy, positive dromotropy, positive inotropy, positive lysotropy by means of adrenergic receptors and adrenergic neurotransmitter like norepinephrine. But if you have acetylcholine, or if it is an M2 receptor, muscarinic receptor, cholinergic receptor, they can suppress. There will be negative effect. They will be having negative effect. So they have asked what is the effect of. So these all things you should know. What they have negative effect. So what is this inotropy? Inotropy is contractility, and chronotropy is rate of SA node, rate of the heart. So contractility is increased by adrenergic drug. Rate of the heart is increased by, that is chronotropy is increased by the adrenergic drug. Dromotropy is conduction from the AV node. Conduction of electric current is also increased by adrenaline or sympathetic nerve, or you can say adrenergic drug action. And bathomotrophy is excitability, which is not shown there. It is also identified in 1897 by the scientist Engelman. That is also you should remember in the long back, and that is also bathotropy is excitability, and lysotropy relaxation activity. So these all are stimulated positive action given by sympathetic nervous system. So you see in the heart, to remember for the student, they have to remember chronotropy, which is rate. Chronotropy is the rate. That is why the graph is given rate per second. What is the beat by means of graph? And inotropy given a muscle, that means contractility by means of showing this picture. And dronotropic is bike is shown, that means conduction, moving. That is just put an arrow, conductivity, that is conductivity is increased. And bathomotropic, you can say it is that is excitation, excitability. So like that, excitability. So like that you can remember these words. They may ask this question also for you sometimes in different manner. So the student will be able to answer. So negative chronotropes. I have come to these all pictures to explain, to know about negative chronotropes. Chronotropy means what? The rate. Decreasing rate can be done by beta blockers like metoprolol, acetylcholine, digoxin, pacemaker current inhibitor. There is a new drug, ibuprofen, that is also having pacemaker current inhibitor. So it will also negative chronotropes, reduces the heart rate. So by blocking the calcium from entering the cell, calcium antagonist produces negative chronotropic effect, decreasing the heart rate. Negative inotropic effect means what? Decreasing the force of myocardial contraction. Inotropic means contraction. Negative dronomotric effect means decreasing conducting velocity through the AV node or atrioventricular node. So you should know this picture. There is negative. That picture will give you to remember many questions they can ask. Instead of asking a simple, they may ask inotropy, negative inotropy, negative chronotropy, negative dromotropy, negative bathomotropy, negative lucitotropy. So these all will be given by parasympathetic nervous system. This all will be given by acetylcholine. This all will be given by digoxin. This all will be given by ibuprofen, metoprolol, which are beta blockers. So you can see that this negative chronotropic effect will be given by acetylcholine. So you should know that one question, 10 question it is equal, which we have discussed now. So and they have given choice like adrenergic effect, sympathomimetic effect, nicotinic effect. But the choice, the answer is negative chronotropic effect. And 13, what is the category of rectus abdominis muscle? So what is the category of rectus abdominal muscle? What is the use of rectus abdominal muscle? So rectus abdominal muscle means we should know it is otherwise called as six-pack muscle, which is shown in the picture. So usually we will think that it is voluntary or involuntary. We will think that it is an involuntary muscle. No, it is a voluntary muscle which is connecting the ribs and to the pelvis. So it has a voluntary muscle. So you can see voluntary muscles are the skeletal muscles that attach to the bone can be consciously activated by controlled movement. Common voluntary skeletal muscle include biceps, triceps, lats, abdominal, gluteus, and quadriceps, which in the thigh, and hamstrings in the thigh muscles. So these all are in the femur muscles. So which we can see these all of them are voluntary muscles. So it is also the abdominal muscle, the rectus abdominal muscle. The answer is voluntary muscle. They are given a choice involuntary, but it is not correct. Cardiac, it is not correct. Nervine is not correct. So what is the effect of acetylcholine on rectus abdominis muscle of frog? So what is the effect of the rectus abdominis muscle? There is in Goudet in 1948 itself he showed the tolosol potentiated acetylcholine induced contracture. It shows contraction in both isolated guinea pig ileum and frog rectus abdominis muscle. So both of them they have isolated and they have seen what is the action of tolosol potentiated acetylcholine in. So they have asked acetylcholine, what is the action of acetylcholine in frog abdominal muscle? It should be contraction. It should be contraction. Contraction. Relaxation? No. Stimulation? No. Suppression? No. So the answer is contraction. So you should know that who have identified already Goudet in 1948 itself he has identified this one. What is the effect of adrenaline on heart rate of frog? What is the effect? So very simple by the graph itself. This is a chymograph, not chemograph, chymograph, which we have seen the previous in this session only. Chymograph, the drum, the smoke drum, by means of isolating heart or the ileum of the guinea pig or the rectum muscle of the frog, isolated, can be connected with the and by means of supplying with ringer solution and with a needle or a pen, which can be given to the graph, and the rotating drum, 7-inch or 5-inch drum, which is rotating. You can see the normal graph of a per second. You can see the normal graph which is obtained. When you inject adrenaline, it increases immediately. You can see that is the contractility is increased very fast. When the contractility is increased, the graph goes up and down. And when the effect is finished, when the ringer lactate is continuously flowing through the heart or flowing to the tissue, it will be coming down after the action because diluted. So then it comes to the normal, and then if you inject acetylcholine, what is happening? It is again the contractility is getting relaxed. So the action is reduced. So they have asked, what is the effect of adrenaline in the heart? You will say it increases, not decreases, not stops. None of the above is also a wrong answer. What is the effect of acetylcholine in the graph itself, in the heart of the heart rate? It decreases. So they are given a choice, same, increase, decrease, stops, and none. It decreases. So the student cannot forget by means of seeing this graph and how they are doing the experiment. You have to memory, and the picture should come in between you. And the 17th question, M2 receptor are present at the location. What location? M2, there is M1, M2, M3, M4, M5. M4 and M5 is not identified where it is present, but still it is the research have been almost identified. But M2 receptor are present in what location? That is one question they have asked. So the student should have an idea, even though where it is present, why you have to answer this question, because there is a choice may be given in such a way you have to answer. So M2 receptor are diffusely located in smooth muscles and cardiac tissues. But usually it is cardiac tissues, but it is located in some usually smooth muscles and cardiac tissues little. So cardiac tissues is the main one, M2 receptor. M3 receptor are present in smooth muscle. So smooth muscle M2 receptor are less, but smooth muscle more is present is M3 and gastric and salivary glands. So the M2 and M3 presence in smooth muscles and tissue is also a choice. Both the place it is present, the student should have an emerging evidence suggests that M2 muscarinic receptor, that is cholinergic receptor, via inhibiting adrenergic cyclase, that adrenyl cyclase causes smooth muscle contraction. So it can cause even acting on the smooth muscle contraction indirectly. That is why smooth muscle also it is present by inhibiting sympathetically, sympathomimetically, that means adrenergically, beta adrenoreceptor mediated relaxation. So in certain disease states, M2 receptor may also contribute to direct smooth muscle contraction. So direct smooth muscle contraction. So here in the picture, especially M2, M3, M3 is written, M3 and M4 and M5 is still in research. M1 is present in CNS, salivary gland, and parietal gland, which causes CNS excitation, memory, locator activity, locomotor activity, and gastric and secretions. So in M2 is present in heart, which decreases the heart rate, force, and AV conduction. That we know very well. Already we have discussed. M3 smooth muscle mainly, but smooth muscle is also M2 is present, but mainly smooth muscle M3 and that is exocrine glands, and all smooth muscle construct and except and then you can see vasodilation and glandular secretion. So you see, they have given salivary gland, they have given CNS, but endocrine gland, but they have given smooth muscle, but they have not mentioned heart. If they have mentioned heart means you will get confused. M2 is present in heart and slightly it is present in smooth muscle. So where to put the click, that will be a problem for you. But here there is no heart, but M2 is not present in salivary glands, M2 is not present in CNS, M2 is not present in endocrine gland, it is present in smooth muscles. So like that you have to remember. But don't get confused if they put heart muscles or heart, M2 is present. Understand? So they may twist the question and ask anytime. So this is very important. So I am not going to go for a lengthy class like before. I am just concluding here, and we will continue in pharmacology again like this 15 or 10 questions again and again, and we will make ourselves to be comfortable, so that students, once they listen to this class, it will be easy for you. So kindly subscribe my channel Pick Pharma DXP at DX Prasad, and it will be, and if you have any doubt, mail me or you can call me. This is my WhatsApp number also. You can give message. Any improvement, any type of improvements also can need. I can improve myself, because I am also like a student. Just I am giving you some lecture, so it may be improved. Sometimes it should reach the student how to write the exam, how to remember it, and how to choices can be selected, and even if the twisted questions can also be done. Thank you very much. We will see in the next class.